We're live.
All right, good morning, everybody. Thank y'all for being here in person today, and thank y'all for being here online. We're here today to sound the alarm bell about 4344, the foster care bill that came over from the House. I just want to go through where we are as far as we know today, why this bill matters, and maybe what is going to come next. So where we are today is that the House Bill 4344 passed the House 99-1, overwhelming support. It has also passed the Senate Health Committee unanimously. There were some amendments made there. They all passed with broad support, and the bill passed Senate Health unanimously. So the bill now sits in Senate Finance. It would go before Senate Finance before coming to the Senate floor for final passage. Just in case folks aren't clear about the provisions that are included in the bill, there's a data dashboard that provides particular information from DHHR about children in foster care, perhaps the reasons that they've landed in foster care, information about calls to the child abuse hotline. It's an extensive data dashboard that's based on many other states who do similar things in the interest of transparency and accountability. There's a raise for CPS workers, it's actually all social service workers, including child protective services and adult protective services, of 15% on average, over and above the 5% on average that's in the budget bill. There's also MDIT reform or MDT reform, multidisciplinary team reform, as well as the child abuse hotline. There's some changes to that system that stem from a particular incident in the county that I represent. So again, that bill with all those provisions which affect our most vulnerable kids is now sitting in finance, where it has been for, I guess, about a week now. We did this press conference last week about this same bill, and we're very excited, because it had such broad support, and we expected it to move forward pretty quickly, and it has stalled right now. So why does this matter? We pass hundreds and hundreds of bills each year. Why are we taking time 2 weeks in a row to point out this particular bill and say it's really important? Couple reasons. Number one, we've got over 6,000 children in foster care in the state of West Virginia today. Each and every one of those lives matters, and each and every one of those kids has ended up in that situation because of a traumatic experience in their life. They are among our most vulnerable population in the state of West Virginia, and we owe them our very best to have a brighter future. If you look at the numbers in a little more detail, over the past decade, the number of kids who are in state custody in West Virginia has gone up over 70%, just in the last decade. And I mentioned a specific incident before in the county that I represent, the county I'm from, Greenbrier County. There was an incident last year where 5 children died. There was a phone call about suspected abuse made to the child abuse hotline. It was screened out. It never made it to the local office. It never made it to law enforcement. And so this is very real to my home community in which this happened. It's a tragedy that we're still mourning today, a little over a year later. So with that in mind, where the bill is now, why it matters, what's going to happen next. There are a couple of options before us. As I mentioned before, the bill right now is sitting in Senate Finance. I am hopeful that Senate leadership will do the right thing and put the bill on an agenda. It should be on the finance agenda. Finance is meeting today. The problem is that Finance's stated agenda does not have the bill on it at this point. That could change. I'm hopeful it will change. I'm hopeful that Senate leadership will do the right thing. If that doesn't happen, if the bill does not make it on an agenda, then the only option at this point, at the end of the legislative session, is to move to discharge it. That doesn't work very often because in some ways it bypasses the normal legislative process. It is a last-ditch effort that I'm willing to make if needed, but I'm hopeful again the Senate leadership will do the right thing. The other option that could happen here, if Senate leadership doesn't run the bill, if a move to discharge is unsuccessful, what could happen is the bill dies. 4344 goes nowhere. Then we have no data dashboard. We have no CPS raises, no APS raises, no social service raises, no MDT reform, no child abuse hotline reform. All of that goes away on a bill that passed 99-1 that affects our most vulnerable kids in West Virginia. And that to me is completely unacceptable. That's the option that we have to avoid at all costs. We talk a lot here about our principles and about our values and about our priorities, but this is going to show what our principles and what our values and what our priorities are. If this bill were to die, it would show that it's just all talk, that our values and priorities really do not lie with the most vulnerable among us. If you look at our budget right now, we're going to have over $1 billion surplus. Where are our priorities? We can't do a 15% pay raise for CPS workers, that we can't afford a data dashboard to hold DHHR accountable. It makes absolutely no sense to me. So I don't want to hear any more about what our values and priorities are. I want to see it. I want to see our values and priorities. I've got two other folks here. I don't mean to monopolize the time. I'm sorry. I feel very strongly about this. Senator Lindsay is with us, and he's going to speak a little bit about this bill. And then Marissa Sanders from the West Virginia Foster, Adoptive, and Kinship Network is going to as well. So, Senator Lindsay.
Yes, thank you. And thank everyone for being here today. I think everyone can agree, or should be able to agree, that the most important thing a society and government can do, our most sacred duty, is to protect the most vulnerable in society. And there are a few folks that are more vulnerable than our children in the foster care system. These are children that have gone through quite a lot, probably more than most people, or definitely more than most people, and the trauma involved in just about every circumstance. I want to step back for a moment and just educate folks who may just be cluing into this during this last week of session. What people need to know is 4344 is the culmination of a years-long work. There have been interim committees throughout the year that have talked about the fact that foster care parents don't know what's going on. They're out of the loop. DHHR workers and CPS workers find themselves in the same position. Commissioner Larry Pack acknowledged at an interim committee, Jeff Pack, acknowledged at a committee meeting, interim committee, that part of the problem, the managed care systems haven't been as efficient as they were promised to be, which has created confusion. He also testified and acknowledged the fact that they're having trouble retaining and keeping folks in to become and continue to be social workers. They're overburdened. They get paid far too less for the work that they do. And so this bill 4344 is the culmination of that. Intake and consideration of all the stakeholders to try to tackle this immense problem. And just as Leader Baldwin acknowledged, this bill passed 99-1 in the House of Delegates. So we have Republicans, Democrats, conservatives, liberals, all speaking from the same Bible, all singing the same tune, and yet it stops here. And to date, we've not been provided any justification as to why it's not on the finance agenda, why it hasn't been put on the floor. And as I said from the outset, this is something that everyone agrees needs to be done. We have 27% vacancies for our CPS workers. We have 6,000 kids in the foster care system. We have foster care parents who I think have done one of the most honorable things an individual can do in taking a child that's not theirs and provide them with a safe home, provide them with comfort, and they don't know what's going on. There is no central intake at the moment. There is no data dashboard in order to figure out how many times a child's been in a home, how many times a child's needed care, how many times this, that, and the other. And all that information is important in order to provide the safest and most stable environment for our foster care children. It is unacceptable that we've gotten to this point. We shouldn't have to have press conferences with 3 to 4 days left in the legislative session to make sure that this bill gets through. What I ask everyone to do here within hearing of my voice, contact all the members of the Finance Committee, Senate Finance Committee. Let them know how important this issue is. In fact, I think it's the most important issue we've tackled this legislative session. I can't think of anything that comes close to it. Contact them, reach out, and have them tell you why that's not on the agenda. Democrats and Republicans, have them pick up the phone and explain to you why it's not on the agenda. That's what people can do, and I hope everyone does it. Thank you. Oh, I'm sorry. Marissa Saunders is here, and you have the floor, ma'am.
Good morning. My name is Marissa Sanders. I'm the director of the West Virginia Foster, Adoptive, and Kinship Parents Network, and I want to thank both the senators for having me here today and for the opportunity to talk about how important this bill is. And I know when you hear the list of things that are in the bill, it doesn't sound that exciting. It doesn't sound like something that's earth-shattering, that's really going to change the system. But the parents that I work with, when I ask them what they care about a couple things. One, they care about making sure that DHHR is a competitive employer, that they're able to hire and retain enough workers so that the workers are able to do, and that they're able to hire and retain high-quality workers so that they're able to do the job. This is a very difficult job. This is a job that is not fun. Many days is not fun. It's very challenging. And foster families often feel like they're not getting the communication that they need, as we heard from Senator Lindsay. So we need more workers. We need to make the caseloads more manageable. We need to make this job doable for them. And if that requires raises, then that's what we need to make sure that that's happening. The other thing that they really care about, as boring as it sounds, is this data dashboard. And nobody gets excited about data normally. It's a bunch of numbers, right? But the reality is that we measure what we care about, first of all. Secondly, the only way that we have any idea really what's happening in our system is by looking at those numbers. Now, when people think of Child Protective Services and foster care, they typically think of kids who are physically abused, sexually abused, neglected, severely neglected. In reality, at least on a national level, I can tell you that is a very, very small percentage of the children in foster care, like 3 or 4%, very small percent. Can I tell you what percentage that is in West Virginia? No, because I don't have that data. I don't have the data that tells me why are kids coming into care. On a national level, we do report some data to the feds that gives us a little bit of a picture of that, but not a detailed one. But we know that there are a number of kids who are in care because their parents are struggling to manage the child's behavior, which is really a response to some kind of trauma. We know that there are kids in care because their parents are struggling financially and don't have access to adequate housing. What we don't know is how many of those kids are there with inadequate housing in Berkeley County? How many are in Mingo County? We don't know, and then we don't know how to address those problems. We don't have a way to get upstream and really look at what are the issues that are causing kids to come into care. We do know from national numbers that West Virginia investigates and removes more children by a huge margin than per capita than any other state in the country. So we have to get a handle on why our kids are coming into care. We have to get a handle on what's happening to them once they come into the system. How many times are they moved? Are they stable? Are they adopted when they leave? Are they going back to their birth parents? Are they aging out? All of those things are things that we need to know. And we need to know it on a state level so that our legislators and DHHR can address the challenges. We also need to know it on a local level. Probably at least once a month, I get a call from a church or a community organization who says, we recognize that there's this huge problem with foster care and we really want to help address it. We want to help the families in our area. How many families are there? I don't know. How many kids are there in care in my county? I don't know. Why are they there? We don't have that data. I don't have that information. And that makes it very difficult for the local community to look at how can we help serve our families either before kids are removed and then also help the foster families who are caring for them. This is both it's a national issue, it's a state issue, and it's very much a local issue. And to address that, we really need this data. And as you've heard, this has been a bipartisan effort. It passed the House 99-1. And the Senate Health Committee added some really important information to the data dashboard about the types of data that have to be reported so that we can have a full picture of what's really happening in and around this system. If I were to have the opportunity to speak with Senate leadership, which I hope I'll have today at some point, even if it's a few minutes, I would have a few questions. I would love to know what their concerns are. What are their questions about this bill? What are the concerns? I would love to know what they'd like me to tell the foster families that I'm hearing from who are calling me wanting to know what's going on with this bill. And I'd really like to know if with it passed the House, it's passed a Senate committee, doesn't it deserve a place on the agenda so that the full Senate can give it consideration and really look at the issues? Certainly the pay raises are important, the reforms to MDTs and to, which is, by the way, it's a team meeting where ideally lots of people involved in a family's life sit down and discuss what should happen with the case. Often that doesn't happen, so that these reforms are needed. The study and the reforms around central intake are important. It seems like all of those issues are really important and really deserve the full Senate's consideration. So we certainly, the network certainly hopes that it gets on the Finance Committee agenda today, ideally, or somehow gets voted by the full Senate, because this really is important for moving our system forward. So thank you for listening, and thank you again for the opportunity to share, and I think we're taking questions.
Yep,
Sure.
Thank you. Thank you, Marissa. Anybody have questions here in person? Amelia. And then we'll do them online here with our Zoom participants as well.
Where is the agency on this? Where's DHHR? Because it's appeared in these committee meetings, this is an agency-backed bill, so where are they this week?
That's a great question. I don't know. I mean, as I think Senator Lindsay mentioned that Commissioner Pack has been, I think, pretty public about his support for this. He said, you know, we have these alarming numbers of vacancies. We need to do something about those vacancies. It inhibits his division's ability to do their job. I believe he testified over on the House side in support. I saw him on West Virginia Public Broadcasting, you know, speaking in support of the bill. But I don't know where the agency is now that we're at crunch time. I haven't heard from anybody in the agency. And again, you know, you can tell me all about your priorities months or weeks ago. This is when it counts. Show me right now what your priorities are, because we're up against the deadline. And this is when we need to be hearing from them if they really do support this, as they've said they do for months now.
Before we continue with questions, there's another bill we wanted to talk about. Senator Stallings just walked in, and is able to talk about that.
Yeah, so another public health related bill that we're concerned about is an insulin cap bill. So Dr. Stollings is going to address that, and then we'll get back to questions.
Well, I certainly want to focus, as we should, on this foster care and child welfare crisis. So appreciate the ability to come in here real quick. But yeah, so House Bill 4252 and Senate Bill 176. Well, the House Bill 4252 basically caps the cost of insulin and all insulin-like drugs like Ozempics and Trulicity at $100. It also incorporates all the testing supplies, which is also potentially very expensive. This thing was running through, it was doing great until it went to the Finance Committee. And let me back up a bit. The Senate Health Committee wanted to include PEIA insureds because it's an insurance company, and the chairman and the committee thought that they should be included as well in this cap. And so that was amended. That actually put a little bit of state money into the equation. And when we talked to or when the bill was in front of Finance, the Finance Chairman, Senator Tarr, didn't want any money into this, any state money. And so there was a discussion with his attorney, and then Senator Maroney, the chairman of the Health Committee, went up. And the next thing I know, the vice chairman of Senate Finance, Senator Seipolt, moved to table the bill. And that's a non-debatable motion, so we couldn't talk about it. We couldn't say, look, we'll take a bite of the apple. We'll take PEIA out if we're not going to spend a penny on this, if that's so important. And so, but we haven't gotten to that point. So, at this point, the bill is dead, and I have been doing behind-the-scenes work, as a lot of us have, trying to resurrect the bill. Even if we take PEIA out, that would at least let other members, other insureds in West Virginia to benefit from capping the cost of insulin and diabetic supplies at $100 a month of out-of-pocket cost. I can tell you as a practicing internal medicine doctor, adult medicine specialist, and geriatrician that that's a big deal to our patients. We have so many diabetics, and I can't tell you how many people come in and say, I can't afford my Lantus or my Levemir. That's a long-acting insulin. I can't afford my Ozempic or my Trulicity. Those are long-acting non-insulin injectables. And so therefore, their sugar is not well controlled. And then they develop all the bad things that you develop when your sugar is not controlled. Eye and vision issues, kidney issues, cardiovascular issues, neuropathy. So this is an important bill, and it just breaks my heart that we haven't been able to resurrect this. Again, ongoing negotiations are happening right now. We're trying to, do anything we can to resurrect this bill and to resurrect the very important foster and child welfare bill. So we're down to crunch time. It's Wednesday. If we can't get something going here real soon, we're going to lose these two important bills that are important to West Virginians and would, to be honest, save so much money later on if your children are taken care of, or if your diabetes is well controlled. And it's, I think the PEIA fiscal note was $177,000. That said, the reason I say we could potentially take PEIA out of it, it'd be against my overall wishes, but if $177,000 is too much to pay for close, good diabetic control for your state employees, when you have $1 billion surplus, okay, when you have $1 billion surplus, then the PEIA system has a deductible. Once you reach that deductible, then most out-of-pocket costs are covered. So if we have to take a bite of the apple, I'd certainly do that. But otherwise, I think it's just a travesty.
Senator Stallings is also available for questions as well. And again, those on Zoom, please put them in the chat.
Are you checking those?
Yes,
Brittany?
I have got them up.
Okay.
We have one, but I'll let people in the room go first.
Okay, did anybody else in the room have additional questions? All right, let's go to the Zoom.
Okay, Michaela Newton with WDVM says, how will House Bill 4344 affect the work of social workers? What will the process look like for the families and the children involved?
How will it affect social workers?
Like CPS, frontline workers.
Oh, so social services workers. I got you. Okay. So 4344 includes a 15% average pay bump for everybody in social services. So that's, for example, CPS and APS. So right now, if you are, you've got your social work degree and you go to work in CPS, with a master's degree, you start out making around $30,000 a year. That is exceedingly low compared to our surrounding states. This is a step in the right direction. It doesn't even put us on par with our surrounding states, but it's a step in the right direction. I mean, the folks that I know that work in social services at the local DHHR level, they are not doing it because of the money. I mean, they're doing it because they care about their community and they care about people. But at some point, you have to be able to take care of your family. You have to be able to live. And again, you're paying off student loan debt for a master's degree, making $30,000 a year. It's just completely unsustainable, and again, does not reflect our values and priorities. If our kids are our top value and our top priority, then we need to make sure we adequately compensate folks who are doing that difficult work every day. Anybody else?
One more question for you. 692, which was your bill about the intake system, it was tucked into the foster care bill. Were you told that that would help it get through? Because you've now lost your bill as well. So can you walk us through that process a little bit?
Yeah, so 692, which was a change of the child abuse hotline process, was not run. But I was able to work with, and I thank Senator Maroney, the Senate Health Chair, who thought this was a really important issue and thought that the best way forward was to include that in this larger foster care bill, since it was a very much a related issue. And the House version that actually came across had a study of the child abuse hotline. Now, I don't think, we need another study at this point. Like, we know what happened. 5 kids died. Now, was it a direct result? No. If things had gone differently with that phone call, could those kids have been saved? Maybe, maybe not. But we know what the issues are at this point. We don't need another study. We need to make changes. DHHR could make these changes themselves internally. They don't need us to force them to. But by them refusing to make any changes, when 5 children die, then it puts us in a position of having to force their hand. So that is in the bill that's passed Senate Health now unanimously and is before Finance.
Can I add one?
Marissa?
I'll just add, with regard to central intake, the other reform that was made that was not part of that original bill is that the current 4344 currently expands the work of the Office of the Foster Care Ombudsman to allow them to investigate and take a look at the entire process from the very time, from the moment that the call comes into the hotline all the way until the end of the case. Currently in code, the way that it's being interpreted, it only allows them to investigate once the child has been taken into DHHR custody. But there's a long process that can happen prior to that from the time that the call comes into central intake. So this would help to also take a really good look at what's happening with those calls when they come in and how are they being screened in and out and that process. And if I can add one thing that I forgot to say earlier, when you look at the data in the bill currently, it might look a little bit overwhelming because there's a whole lot in there. The reality is, first of all, as we heard, other states have data dashboards for their child welfare, many, many states, and they have about 10 times that amount of data in most of them, so it's not that much. But the other reality is that all of that, most of the data in the bill is currently reported to the federal government. The challenge with the data that goes to the federal government is that it doesn't come back in a way that you can really track and identify trends over time, and it's not easily accessible. It's available if you know how to look for it and you dig for it, but it's hard to track and compare to different years. And so that's one of the things we're asking for is data that we can really see how have things changed and improved and where are we still needing to make improvements. But the reality is that the department collects mountains of data. They have a ton of data. They run their own reports. They run them internally. They analyze them internally. Really all we're asking, a dashboard is a fancy word for a website. It may sound expensive, and I've heard that there may be some concerns over that cost. It's really a website. All we're asking is for them to take the data they already collect and put on a website so that the local community organization or church can figure out how many families they have in their community that they can help. So the legislators can see what's happening with numbers over time so that those of us working on a state level are able to identify the trends. So it's really not a huge lift, even though it may look a little bit large in the bill. So
Just real quick, are there any other questions?
There is, but I'll give it to you after you
Oh.
say your piece.
Well, then I want you to give me the question first, because I was just going to wrap it up, if that's okay.
It's about a slightly different issue.
Okay, well, on these two issues, the through line between the foster care bill, 4344, and the insulin cap bill that I want everyone to take away from this press conference is, A, both those bills are very popular and enjoy bipartisan support. B, they affect tens of thousands, if not hundreds of thousands of West Virginians between both of them. I would dare say that there are more diabetics per capita in West Virginia than about any other state in the country. So we're talking about things that really matter to folks. And 3, no justification, 0 justification has been given as to why either deal hasn't shown up on the Finance Committee agenda or on the floor. And so I task everyone listening, all reporters, all constituents, all citizens to reach out to the Senate Finance Committee and ask the individuals on the committee why both bills aren't on the agenda. And then I got a question, I guess.
Yeah, Brown McElhaney says, thank you for having the session today. A different bill that you actually might not want to run is also against the deadline. The House's 15-week abortion ban. Any idea why that got hung up?
I have no idea on that either. Brad, you need to ask the folks who control the agendas. So we don't.
Anything else in the room?
Nope. Thank you.
All right.
Thank y'all. Appreciate
Thank you,
y'all
thank
coming
you.
in person. Thank y'all for coming on Zoom. Y'all have a nice day.
like to try to get some more on one, if that's all right.
Yeah, sure.
Thank you, Pam.
Do we need to capture the chat?
Do you want to,
Thank you for asking.
you want to do?
Thanks, everybody.
You go for it, that's fine.
I gotta go plant myself outside.
Thank you all for being here.